Sciatic nerve pain is something that we see consistently in the clinic, and it's one of the easiest things that we fix. The first thing that we have to look at is the anatomy of the sciatic nerve, and we have to think about the muscles around it are kind of like our pants. Let me describe that to you. So just looking at the musculature and the spine right here. So we have all these nerves coming out to the side. They're coming down through the pelvis and coming out this sciatic notch right here. And this is a big flat nerve right here. It's coming down the leg and through your glute. So if all the way down our leg, and we'll get you a model showing you probably next week, showing you exactly where it goes through the leg. But right now, coming down my glute and then coming back through the back of my leg, and then it bifurcates and it splits off down into my ankle. And what I want to think about is that if I have misfiring, if I have compression on that nerve, then I'm going to end up having problems around where the nerve is getting compressed. So there's several different pinch points down my leg, and I want to address each one of them. So the first pinch point is right here in our lumbar spine. So in the lumbar spine, if we have a disc bulge right here, we're going to be pressing on the nerve. That's going to cause irritation, and then we're going to get misfiring in the muscles. The muscles are going to start to tighten up, and it's really the body trying to create some type of stability in that area. With this model, you can see that when I put pressure on my spine, I go into flexion, then it pushes out the side. So that disc bulge is pressing on the nerve right there, closing down the space. Now, if I don't have pressure in flexion going forward, and I have pressure going into extension, then it closes down the space right here for where that nerve comes out. So we don't want to be in extreme flexion or extreme extension. We actually want to train our body in neutral so we have as much space as possible for those nerves at the first pinch point where the sciatic nerve comes out. So we talked about where it comes from the spine, but then we want to talk about it's coming through here, the psoas muscle, which we talked about on this model right here. The psoas, it gets tight, it pulls our back into extension, that closes down space. We want to loosen that muscle up, and we want to fire up our glutes and create some balance there in the back and in the hips. But then as it's coming down, it's actually coming through this sciatic notch right here in the pelvis, and it comes down the back of the leg right here, and we don't want to put pressure directly on the nerve. So all the things that we're going to be showing you in this video is going to be around the nerve. So if this is the nerve and these are the muscles around it, we're going to be digging into the muscles right here. We're going to be digging to the muscles on the other side so that that nerve can glide around. We don't want to be directly on the nerve. If we're directly on the nerve, it's going to be causing pain and sensation to go down the leg, and so you know you're on the wrong spot. Don't chase the area that's causing you pain. Chase the areas around it so that it can glide around. The biggest issue that we see is that we pair our back extensors with our hip flexors when we do movement. So if my back extensors are generating motion, so I'm coming up and I'm pulling through my back extensors over and over, I'm closing down those spaces for the joints and I'm causing irritation to the nerve. If my hip flexors are tight, it's pulling my back into extension. So I'm extending from the front and I'm extending from the back, and that's causing compression on my nerves, and that's going to cause irritation right at the top. So what we're going to talk about is how to train neutral, how to get strong through our hips. We want our Superman, Superwoman emblem. We want it to stay stacked over our belt buckle as much as possible. We want to drive through these areas where we're moving through our hips and our glutes and not putting as much stress on that sciatic nerve. Make sure you subscribe to this channel. We're going to be putting out content specifically focused on the things that we see in the clinic, and we're going to be putting it out consistently on Tuesdays and Thursdays so that you get real world solutions, things that you can do at home to make sure that you're feeling better and staying active. Now, a lot of times people are thinking about their sciatic nerve and they think that they have compression on it, that they have disc bulges, and that's the main problem. But what we see in the clinic is that most people have disc bulges and they don't always have pain. So a lot of times it's about the inflammation. Are we moving through that area of our back, and are we causing inflammation consistently over time? And if we're doing that, then that inflammation is what's causing the compression on the nerve. So if we redistribute stress and get glide in that nerve, then we're taking away some of that inflammation, and we're going to feel better, and it's going to happen consistently when we have to do it on a consistent basis. So these exercises are things that I want you to do consistently on a daily basis. Twice a day is best, and when you do that, you're going to be able to get out of pain and stay out of pain. The last thing that I want to cover is stretching. So a lot of people want to do stretching for sciatic nerve problems. They want to pull on the sciatic nerve, get it to glide around by stretching it. But if we're causing nerve irritation, if you feel that nerve when you're stretching, if you do a hamstring stretch and you're pulling down here and you feel that sciatic nerve more than you feel your hamstring, then that's going to cause you problems. We don't want to pull on an irritated nerve. The nerve is not gliding around. We're actually just putting tension on it, and that's causing your problem to get worse. And one of the biggest things we want to focus on this channel is not making your problems worse, making them better. And so if we take away the cigarettes, we're going to have a healthier lungs. We can give you supplements for your lungs all day, but if we don't take away the cigarettes, then your lungs aren't going to be healthy. So it's the same thing with our sciatic nerve. If we don't take away the negative things that we're doing, like stretching and pulling on it consistently, then all the positive things aren't going to have the biggest impact. The first exercise we're going to do is actually a glute rollout. So what we're going to do is put this ball right here on our glute. We want to loosen up where muscles overlap. So our glute max, our gluteus medius, and our gluteus minimus all collide and cross each other on the outside of the glute right here. So what I want to do is get against the wall sideways, and then I drop down. I don't want to be on the bone. I want to be right at my belt loop right here off to the side, about 30 degrees out to the side. So now I get up against the wall. I drop my weight down, preferably doing this up against a door so I don't put a hole in the wall. We've had that happen before. So we're digging out that glute and loosening it up. You can do this on a countertop at home, but really digging that out, it's going to be uncomfortable, but that's what we want. But we're on the outside of the glute. Earlier we were talking about the muscles are kind of like your pants. And what I mean by that is that if I grab right here and create a corkscrew and tighten it up, now I've got all this tension. That's what's happening to my nerve. Those muscles are so tight that they're causing compression on that nerve because they're pulling around. So what we want to do is loosen up that compression on the glute so that it can start gliding around. We want that nerve to glide. So we do it right in this area. The sciatic nerve is actually running down right here in my glute. So I don't want to be on the nerve. I'm coming off to the side, loosening up those glutes so that that nerve can glide around. So the first exercise we're going to do is just loosening up that glute so that my nerve can glide around, and then I do exercises to reinforce that while I'm using my glutes. Number two, we want to actually roll out our hamstrings. So our hamstrings bifurcate. So we got a big mass of a hamstring right here. It's coming down and then it splits off to the sides right here. And our sciatic nerve is going right through the middle of it. What I want to do is take this ball. I typically get on a countertop at home. I take this ball and I put it right here in the hamstring, and I'm going to put pressure on it. So now I put it right in the middle. It's okay right there. As long as it doesn't zing pain down your leg, then we're totally fine. If it does, then we want to shift over to the side. Now I'm going to put pressure down through my leg, and then I'm just straightening my leg out up and down. I don't have to straighten it out all the way, but I'm getting that glide. So that nerve's gliding around, the muscles are getting extended and flexed. I'm using them, but I'm putting pressure on the muscles and breaking up that tissue. Now I'm going to go off to the inside and do the same thing, putting pressure down on it. And I'm not folded up in my back either. I'm keeping a neutral spine while I'm doing this, and I'm digging that muscle out. And then I'm going to go to the outside. So I want to do 10 swipes with all three positions. So I'm pushing on the outside 10 swipes, in the middle 10 swipes, and then on the inside for 10 swipes. And remember that the area that we're chasing is right here on the hamstring. That's with the medius part where the hamstring bifurcates, where it splits off. And so that's where we're going to get the most mobility, because where muscles cross each other, they have fascia. Fascia is like a sandwich bag. It's around the muscle, in between the muscle and the skin. And we want to loosen up that fascia and get those muscles gliding around each other and allow that nerve to glide around and take that pressure off of it. Exercise number 3 is going to be a hip hinge. So what I want to think about with a hip hinge, this is something that we have got to get down, because everything's going to build off of us hip hinging. We were talking about keeping our Superman, Superwoman emblem stacked over our belt buckle, and we're driving through the hips right here, and I'm moving through using my glutes. Now, to reinforce that, if I'm going to grab something off of a table, I'm going to reach back like this and come back up. That's movement through my hips. So this right here is a hip hinge, so I'm going backward and forward instead of thinking about going up and down, going down like this. This puts a lot of pressure on my knees, and then it also puts pressure on my back if I'm on my toes. So what I want to reinforce is putting my weight on my heels and shifting my hips back and allowing my chest to come down and keeping my face in line with my chest. And what I'll do is get up against a wall. When I get up against the wall, I'm gonna measure my foot length. So your foot length is what you wanna measure away from the wall. So I just touch the wall with the back of my heel, measure out to my toe, and then I come out to the side. Now I'm gonna allow my face to come down and I'm reaching back with my butt. It's like my lower legs are stakes that are driven into the ground. They're going totally vertical. And then I'm coming back up. So I'm pushing my butt back. You think about a little kid, if you got a kid or grandkid, you want to push them back. You're smashing their head with your butt. We're pushing them back, right? And then they muster up the strength and they're pushing your butt back up. That's what you want to think about, is that movement should come right here through the butt bones right here. So I'm reaching back, pushing with my hips, and then pushing forward with my hips. Back with my hips, forward with my hips, keeping my face in line with my chest. This is one of the most important things that we do, is maintain a neutral spine and move through the hips and strengthen up those glutes. And we want to recreate those movement patterns. If you do this 5 times a day, I'd be happy. You're going to get really good results from it as long as you're doing good form. So refer back to this video on exactly how we do it. Get your measurement away from the wall, and that's going to be the best way for you to practice. And then you can also get a chair in front of you. So right here, I put this chair in front of me, and then now I'm gonna reach back and I'm not touching the chair. So the chair is right in front of my lower leg and I'm not touching it at all. So my knees aren't shifting forward. And that's an easy way to dictate whether your knees are shifting forward and you're moving through your knees and your low back instead of moving through your hips. And we want you to feel tension through your hamstrings for probably the first 3 weeks, and then you'll start getting more tension and burning through your glutes. The fourth exercise we're gonna do to zap sciatic nerve pain is doing an active pigeon. It's a lot like a pigeon pose in yoga. What I'm gonna do is I'm gonna get on my bed, on this table. I can get on the floor. If it's easy for you to get up and down from the floor, then that's totally fine. And we'll give you another option if you can't get into this position or you have knee pain. So what I'm gonna do is I'm gonna slide this left foot underneath my right leg, and then I'm gonna drift back right here. So now I'm putting that sciatic nerve on tension, and then I'm using the glute to drive me back up. But I'm keeping my back in a neutral position, and I'm just gliding right here. Now I'm gonna do this, I'm gonna do 10 reps right here, getting that nerve to glide around and fire up my glutes, and then I'm gonna switch sides. One thing that I really dislike when people do it, because it causes a lot of their back to go into a lot of flexion, is that they'll try to drive this leg up here to get into that position. It causes it to tweak. It causes it to tweak. So what I wanna do is just slide my leg underneath and then drift back. And that's the easiest way for me to glide into the proper position, using that glute coming up, keeping my back in a neutral position and driving through this. And we do 10 of them. We want to do 2 sets of that with this routine. Now, if you have trouble getting on your knees, then there's another option that we can lay on our back. If we have back problems, if we have sciatica, then we want to lay down to the side consistently. We don't want to put all this stress on our back. This puts a lot of stress on our back to go up and down this way. So what I'm going to do is I'm going to lay down to the side, and then I'm going to roll back right here. Now, the same movement pattern is putting my leg up right here, and then I'm gonna pull my knee right here with my right arm, and my left arm, it's my right leg up, my right arm is right here above the knee, and then my left hand is on the lower leg. I'm gonna pull towards my opposite shoulder, and then I'm gonna drive away, and I'm doing 10 reps. Just using those muscles and making them glide around. Same thing, I'll just do a switch, get this leg over, and I'll be pulling for 3 seconds and then pushing for 3 seconds, and then pulling for 3 seconds and then pushing for 3 seconds. If you do that consistently, you're going to get a lot of glide in that nerve, and we're going to be using the correct muscles and reinforcing it. And then if you can progress to doing the active pigeon, you're going to get a lot out of that. And the objective is always to do the highest value activities. So we want to make these progressions, and follow us for videos on exactly what progressions you should be doing, because ultimately what we want to do is do the highest value activities. And when you do that, then you have to spend less time managing some of these symptoms. To summarize the video, we're working through our glutes, working through our hips, and getting that nerve to glide. We're avoiding extreme back flexion and extreme back extension. So even on that exercise where we're laying on our back and we're doing our hip stretch and we're pushing with it, that we don't want to pull in through our back. We don't need to go so excessively that we're pulling through the back. We're trying to disassociate our lumbar spine from our hips. And when we do that consistently, we take stress off that sciatic nerve because we attack that first pinch point. The rollouts on the glute, the rollout on the hamstring is attaching pinch points number 2 and 3. And then we get the glide with the hip hinge, and then we get an even better glide with our active pigeon and doing that stretch. So do these exercises consistently and let us know in the comments how they work. If your sciatic nerve pain is going all the way down to your foot, going down to the lower leg, then we have some extra stuff that you need to do. Just make a comment and let us know, and we'll put together a video for that. Make sure you hit the like button and subscribe, and hit that bell icon, because that's going to give you notifications when new videos come out. And since we're adding to this so that you can get a more comprehensive list of things to do to make yourself better, you want to get those notifications. You don't want to miss out on any videos.